All right, hey everybody. Good morning. It is Dr. Rafich from Vet Triage. Saturday, January 4th, 2025, 10:39 a.m. Pacific Time. We're starting a brand new journal today. Woo, exciting. Veterinary surgery, boom, from October 2024. This journal, just so you guys know, some of it's really cool stuff, some of it's just very technical. And this paper we're going to do today is going to be very technical. So we'll see how it goes. This is enhancing prosthesis stability in the cricoid cartilage in equine laryngoplasty using a 3D printed laryngeal clamp, an ex vivo model study. So a couple things to talk about right then and there. In dogs, they get a condition called laryngeal paralysis. And if you look at my YouTube channel, I have many lectures on laryngeal paralysis if you want to learn about that. So this is this prosthetic they want to try here is an attempt to help improve the success rate, or rather mitigate the failure rate of horses that get laryngeal paralysis. And so this seems to be probably a more common condition in horses, but it's very common in dogs too, so I don't know how they compare. But regardless, it's common enough that they're trying to figure out a way to do it better than they typically do. And just like in dogs, the equine version of this surgery has multiple variations, modifications, surgery types, whatever. The ex vivo model study means that they're performing this study outside of an actual body, which means usually cadavers or something like that. So that's what that means. The study comes out of the University of Tennessee, University of Kentucky, and that's it. All right, so the objective is to assess a three-dimensional printed laryngeal clamp, so 3D printed laryngeal clamp designed to enhance the anchoring of laryngeal prosthesis at the cricoid cartilage. The most common surgery is called a tie-back surgery, and we take a strong suture material, usually a non-absorbable suture, so it stays in there forever, and we place it in the laryngeal region to mimic the natural functionality of the larynx, help keep the larynx open so that the animals can breathe better. So what they're doing here is they're placing a clamp, they're testing a clamp to see if that helps with the success rate of surgery. It's an ex vivo biomedical study. They used 22 equine larynges, which is plural for larynx. Methods, they had two experimental groups, the standard prosthetic laryngoplasty and then the prosthetic laryngoplasty modified with a laryngeal clamp. So in this paper, what we're going to do is we'll just call the standard one standard and the modified one the clamp. They underwent 3,000 cycles of tension loading and a single tension to failure. They measured maximum load, actuator displacement, construct failure, and finite element analysis. So for the website below that you can see that graph, that's a typical load displacement curve that shows if you take a prosthetic and you place it under load, it usually follows a pretty standard curve. And so you can see in the curve on the left where at the zero, you have an elastic range going from 0 to 15,000. Again, the numbers don't matter, but so the elastic range is typically where the prosthetic is malleable. And then there's a yield point where the deformity of the prosthetic goes from reversible to irreversible, and that's the yield point. And then because it's no longer malleable or as malleable, when you hit that 20,000 mark, you hit ultimate strength, where that's pretty much it. And then that's all you can do with that prosthetic. And then any more load ends up failing, and that's the failure point. So that's what a lot of these terms are. But again, keep in mind, this is going to be a very complex paper, and I can't describe everything in here. I'm not an engineer, but at least that graph can help you visualize it. Results: the maximum load at a single tension to failure was 183.7 newtons for the standard and 292.7 newtons for the clamp. Actuator displacement at 30 newtons was 1.7 millimeters for the standard and 2.7 millimeters for the clamp. The cause of the standard failure was mostly tearing through the cartilage, whereas the clamp failed through fracture of the cricoid cartilage. The finite element analysis revealed an 11-fold reduction in the maximum equivalent plastic strain, a 4-fold reduction in maximum compressive stress, and a 2-fold increase in the volume of engaged cartilage in the clamp constructs. The conclusion was that the clamp demonstrated superior performance. Introduction. Recurrent laryngeal neuropathy, which is what causes laryngeal paralysis, in the equine population can be between 24 and 64%. The current standard treatment of horses affected with this is modification of an original technique of prosthetic laryngoplasty described by another study. A suture is implanted between the caudal edge of the cricoid cartilage and the muscular process of the arytenoid cartilage. Those are the two anchor points of this prosthetic suture, like I mentioned, to help keep the arytenoid cartilages open so the animal can breathe. Tightening the suture mimics the contraction of the cricoarytenoidealis dorsalis muscle, which is the primary abductor of the arytenoid cartilage. That muscle is what opens up your vocal cords so you can breathe. And in this condition, for some reason, the nerves are no longer functional. They deteriorate, they degenerate. And because they degenerate, the muscle that the nerve innervates, which is the cricoarytenoideus dorsalis muscle, it starts to atrophy. And then with that, you get laryngeal paralysis. It improves the racing performance in 45 to 70% of horses that suffer from this. Poor surgical outcomes have been explained by loss of abduction of the arytenoid cartilage, usually within the first 6 weeks after surgery. You can have breakage of the implant, loosening of the implant due to the suture cutting through the muscular process of the arytenoid cartilage or the caudal edge of the cricoid, and suture slipping abaxially on the caudal edge of the cricoid cartilage. Suture cutting through the cartilage has been blamed on the abrasive properties of braided suture, such as polyester or polyethylene sutures, jacketed with braided polyester that is commonly used to perform the laryngoplasty. We don't use braided in small animals and dogs. We use monofilament. The abrasive properties favor shear damage during cyclic loading that ultimately causes the prosthesis to open or to loosen. Novel implants have been developed to enhance not only the static stability of the construct, but also the dynamic stability of the implant. The shape of the caudal border of the equine cricoid varies considerably and can be responsible for slipping of the suture. The stability of the suture in the cricoid has been improved by placing a suture through the cartilage using a double loop, or by placing it through the cartilage in a U fashion without engaging the caudal border. Or you can also bolster the suture with a metallic button. And again, when you have this many modifications of a surgery, you know that we don't have a handle on the right way to do it. Implants can be designed by using the technology to fit the complex anatomy of the site into which they are being inserted, and they can be adjusted to fit the needs of the individual patient. That's in reference to these clamps where they use 3D printing. Previously, the implants were developed and reported using a stainless steel clamp in the laryngeal advancement constructs with encouraging results. Materials and methods. This is the picture that you can see there in the thumbnail of the clamp. This is the clamp method, and they have all the labels of what the different parts of it are. They used a biocompatible polymer called polylactic acid. The suture they use one end of a 5 USP or 7 metric multi-strand ultra high molecular weight polyethylene suture with a braided jacket of polyester, and it was threaded through the holes of the clamp. They secured it with a surgeon's knot with 7 throws, which is pretty typical of what we do in dogs too. For specimen preparation and measurements, they included the soft tissue around the 22 cadaver larynges, and they removed the cricoarytenoideus dorsalis muscle, and they used a power drill to create the hole to place the suture material. For the prosthetic laryngoplasty, we already mentioned what suture they used. They attach it to a half-circle trocar point needle, and they placed it in a fashion that mimics the typical surgery. And that's for the standard procedure as well as the clamp procedure with some variation, but they tried keeping it the same, of course. The finite element analysis, a 16 gauge wire was used instead of suture to create constructs because the wire was more readily opaque than the suture, and then they used CT scans using a 40 slice helical CT scanner. For construct biomedical testing, the method by which the construct failed, the maximum load to failure, the actuator displacement at maximum load, the load at yield, the actuator displacement at yield, the hysteresis of the construct, the actuator displacement at 30 newtons, and the stiffness of the construct were all recorded. Method of failure was defined as breakage of the cartilage or breakage of the implant. Maximum load was defined as load applied by the actuator to the construct immediately before the construct failed. The yield point was defined at the point at which the offset line and the load displacement curve intersected and corresponded to the onset of cartilaginous damage. The stiffness of the construct was calculated from the load over displacement curve immediately at the finish of cyclic loading. Hysteresis of the construct was defined as the distance from the onset of cyclic loading to the end of cyclic loading, and the actuator displacement at 30 newtons. Load was attributed to suture migration, meaning cutting into the cartilage, or correlated to the slack within the suture. And then here you can see in this picture the areas of failure. So the PL construct is the standard, and the PLC is the clamp. And you see how it broke the suture, the cartilage rather. So the suture and tested standard construct gradually cut through the cartilage and then pulling through. The clamp construct failed by breaking off the caudal edge of the cricoid. Okay, results. Study population. Horses were 8.8 years old, 557.8 kilograms, mostly thoroughbreds. Biomechanical testing results. The standard construct had a maximum load of 183.7 newtons, while the clamp had a maximum load of 292.7 newtons. The load at yield of the standard was 144.5 newtons, and the clamp was 283.9 newtons. 289.3. The actuator displacement at maximum load for standard was 26.8 millimeters, and for the clamp 43.3 millimeters. The actuator displacement at yield for the standard was 13.9 millimeters, and for the clamp 41.6 millimeters. The stiffness of the standard was 9.33 Newton per millimeter squared, and that of the clamp was 7.4 Newton per millimeter squared. Hysteresis after cyclic loading of the standard was 5.4 millimeters, and for the clamp was 8.5 millimeters. I mean, you can notice a trend here where the numbers for the clamp are typically higher. The actuator displaced at 1.7 millimeters at 30 newtons for standard because the suture tore through the cartilage, and the actuator displacement 2.7 millimeters at 30 newtons for the clamp because of reduction of slack. The cause of failure of all 10 standard was tearing of the cricoid cartilage, and the cause of failure for the clamp was fracture of the cricoid, tearing of the cricoid, and breakage of the clamp. With finite element analysis, here you can actually see there's a graph that shows the biomechanical testing. So kind of similar curve where you have a slope and then a plateauing and then a failure. Let's see, finite element analysis. Several advantages of the clamp construct over the standard were observed. Using finite element analysis, the maximum tensile load in the clamp was 268.5 Newton, which is higher than the standard of 184.6 Newton, and closely matched that of experimental results. The maximum strain of the clamp was 0.000307 MPa, which is more than 11 times smaller than the standard. All right, discussion. The clamp construct obtained a greater maximum load and yield, a maximum load and load at yield than that obtained by standard, because the clamp provided a wider distribution of forces from the prosthesis and a larger area of cartilage prosthesis interface than that provided by double looped suture. The results of the finite element analysis revealed that the distribution of the maximum compressive and tensile stress along the interface between the cricoid and the clamp made the clamp construct more mechanically stable than the standard. The yield stress in the cricoid cartilage adjacent to the suture implants, which had been inserted in a double loop fashion in the standard constructs, were greater than the maximum compressive and tensile stress in the cricoid cartilage adjacent to the clamp in the clamp constructs. The concentration of maximum stress and potential sawing effect of the abrasive braided suture explain why the cricoid cartilage tore at a significantly lower force. The actuator displacement at 30 newtons load, yield, maximum load, and hysteresis of the clamp were greater than that of the standard. The calculated stiffness of the clamp was therefore less than that of the standard. Although the difference in actuator displacement between the constructs was low, it could affect the degree of abduction of the retinoid cartilage. The greater actuator displacement in the clamp construct may have been related to a gradual slack reduction of the suture loop within the clamp. A previous study found that braided suture placed with a double loop through the cricoid migrated more than a suture placed in a single loop, and this difference was attributed to the reduction of slack and cutting of the cartilage by the suture. The suture did not cut through the cartilage in the clamps here as it did for this standard. Greater actuator displacement in the clamp constructs could have been attributed to the characteristics of the suture itself. Polyethylene suture is more elastic than polyester, and therefore polyethylene elongates more than polyester during cyclical testing. A stiffer interface between the clamp and the suture as compared with the interface between suture and tissue may have increased the elasticity of the suture, causing the suture to elongate. Greater actuator displacement occurred at greater experimental load in the clamp than the standard. Greater load could result in greater suture elongation in the clamps. Because the elements comprising the two types of construct varied, then we'll leave it there. Polyethylene suture was chosen over polyester because of tensile strength and resistance of fraying of polyethylene is greater than polyester. Most published studies agree that cyclic loading is required to mimic in vivo conditions, meaning in the animal. Those studies using cyclic loading to test the interface between the prosthesis and the cricoid cartilage have used an oscillating load between 25 and 50 newtons over 3,000 to 10,000 cycles. Another study using strain gauges evaluated the physiological forces experienced by laryngeal prosthesis during coughing and swallowing was 27.6 newtons. The mean actuator displacement at 30 newtons in the standard construct in this study, which is 1.7 millimeters at 30 newtons, was similar to that reported in another study, which is 2.7 millimeters at 50 newtons. The maximum load on the standard constructs in this study was 183.7 newtons, lower than the reported other studies of 283 and 229 newtons, perhaps because they excluded the forces of distraction produced by the cricoretinoid joint in this study. The shape of the caudal border of equine cricoid varies in thickness and shape, and these variations affect retention of the prosthesis. A lack of a notch at the caudal border into which the suture is placed, or the prominence lateral to this notch, has been associated with slippage of the suture, which results in loss of abduction of the retinoid cartilage. The clamp wraps around the caudal border of the cricoid, aiming to prevent the slippage. Tensile forces are transferred from the suture to a more stable clamp and tissue interface, eliminating the sawing effect of the suture. Stress is reduced and equally distributed over a greater area across the cricoid cartilage because of the large interface between the clamp and the cartilage. The interface between the prosthesis and the cricoid cartilage is a weak link because it is affected by cyclic loading. Implanting a prosthesis traumatizes the cricoid due to tension applied across the suture gap and likely causes cellular apoptosis. Apoptosis is programmed cellular death and is normal in the body. Because bleeding is crucial to the integration of a prosthesis and to the healing of tissue in which a prosthesis has been inserted, Healing may be impaired when a prosthetic is inserted into tissue with poor vascularity, such as hyaline cartilage, which is the cartilage that makes up the larynx. Implanting a prosthesis with hyaline cartilage produces a zone of cellular death, resulting in a band of necrosis that is 100 to 200 microns wide. Cellular apoptosis gradually extends the width of this band up to 400 microns over 14 days. The clamp transfers tension. The clamp transfers forces of tension experienced by the suture to the clamp, thereby reducing shear and stress applied by the suture to the cartilage. Although the material they created these 3D prints out of is biodegradable, the rate of degradation and crystallinity can be modified by changing the ratio of D-lactic acid to L-lactic acid in the polymer. So lactic acid, we all know, is what builds up when you work out, builds up in your muscles and joints, and is due to ineffective oxygenation, ineffective metabolism, an inefficient system in the body. D-lactic acid and L-lactic acid. So D and L are Latin. D, I believe, is right and L is left, and it's the chemical, the orientation, the directional orientation of the chemical compound. And sometimes when you direct something, let's say take a mirror image of a chemical compound, it can actually affect its mechanical properties or whatever properties. So it degrades to non-toxic compounds such as lactic acid. Implantation of biomaterial, regardless of the composition, always leads to a foreign body reaction, increasing risk of infection and failure. These risks can be mitigated by either impregnating printed implants with antibiotic or using a regenerative product like fibroblast growth factor to enhance the formation of adhesions and integration of the implant. Additive manufacturing offers opportunities to create prostheses composed of other polymers such as poly-E caprolactone. And that's a study. That's a heavy-duty one, man. But it's good. And there you have it. Use it for what you will. Thanks again for supporting the channel. Feel free to subscribe and share. Hit like, please, and support it. We'll talk to you soon. Bye.